This is KTVO's Good Morning Heartland.
For many, a trip to the doctor often involves discussion of cholesterol. It seems we just can't get that bad cholesterol number as low as they'd like. Often side effects from medications to treat cholesterol prevent people from continuing to take them or advance their dose as high as the doctor would like. Two new medications that have a completely new way of working have been approved and are available. Today we have Dr. Justin Puckett here to discuss. And good morning, Dr. Puckett.
Good morning. How are you?
Good. How are you?
Good.
All right. Well, so tell us about these new medications.
Well, it's been a long time since I've been this excited about a new medication because the way that it works is totally revolutionizes the way that we do medications. It's a medication that is extremely potent with the cholesterol, and the way that it works is binding to a protein to allow for the LDL receptor to get recycled over and over again. And so essentially what this does is it can take people who have extremely high bad cholesterol, LDL cholesterol levels, and take them from even 200 and 300, 400 levels down to 50, 60, 70. And even those folks who are on cholesterol medication now and are not to their goal, and if they've got known atherosclerotic disease or any thickening or hardening of the arteries, then they're a candidate for this new medication.
And you mentioned it a little bit. How does it work, though?
Yeah, the way that it works is if you think about the hepatocyte, which is a cell in the liver, and that's kind of the organ that processes our cholesterol. And so there's this LDL receptor that sets up, and whenever LDL molecules come down floating in the bloodstream, they're grabbed by this LDL receptor. The LDL receptor has a little protein down here called a PCSK9, and whenever that binds down at the bottom, they go into the cell. The bad cholesterol gets blown up and stored for energy, but also because of that little protein on the bottom, the whole LDL receptor gets blown up and then has to get completely remanufactured in order to go back up and grab another one. What this does, this chemical, this monoclonal antibody that's injected once every 2 weeks, it actually binds to that little protein piece on the bottom, removing it so that the LDL receptor grabs that cholesterol, goes in, then the bad cholesterol is exploded, but that LDL receptor is salvaged. It's able to escape because it doesn't have that explosion protein attached, and then it recycles back up to the hepatocyte. And so now that one LDL receptor can work 130 times where before it would have only had the use of one. So it makes the body 130 times more efficient at getting cholesterol out of the bloodstream. And because it's a monoclonal antibody, it's very big protein that's injected in just under the skin. But because it's so big, it doesn't cross the blood-brain barrier. It doesn't go into any of the major other organ sites. It's really with a very low side effect profile. And so for that person who's completely unable to tolerate the statins or somebody who's not able to get to goal, this is a perfect new option.
Who should take this new medication?
Well, I think that those folks who are unable to get to their cholesterol down to the goal of less than 70 with a risk factor, or folks who have an intolerance to the statin and so they're not able to get to the maximum dose. It's really important that if they're going to use one of these new drugs, and the trade names for the new drugs are either Repatha or Praluent, and if you're going to use one of those two drugs, they work better because of the dual mechanisms if any of the other cholesterol medicines, especially the statins, are continued. So if you're having trouble taking a statin at a higher dose, you may be able to use this new medication and drop back on the dose a little bit so that those side effects will go away. But they work really synergistically together. So it's not a replacement for those Lipitors and Crestors and all of those sorts of medicine. They're really a complement too.
So if you do take this, what do you do with those other Lipitor and Crestor medications?
Well, it really wouldn't change them at all unless you just needed to drop back, because the new medication would go ahead and pull that down a little bit further so that you could drop back on the statin if it was causing you some of those side effects. And the big side effects that we see with the statins are primarily a muscle ache. A lot of folks will take over-the-counter coenzyme Q10, which can help alleviate that. But if they're just completely intolerant, some people, the smallest amount of cholesterol medicine, and they become real muscle achy, joint achy, and so they kind of get, no one wants to live like that. So if in the past we've tried to use some other adjunct, but outside of the statins, we've got some other medicines that in an appropriate patients can help a little bit. But it's really you know, there's only so much you can do. Even with diet and lifestyle, can have a huge role bringing it down from crazy level highs to a certain level. But if you've got a liver that's programmed to just overproduce cholesterol, then you've got to do something else. You can't eat not enough carbs or fats to keep that down.
There any limitations to the medicine? Lots of positives. But.
Yeah. I think that the big limitation is if you just absolutely refuse for an injection, because it's in a pen device, and it's using a needle that's not much bigger than the diameter of your hair. So it's essentially a painless injection. Patients we give the first injection in the office, and they're like, wow, that was pretty easy. But that's the real primary issue. The other issue could become cost, and so because it's a new medication and because it's a monoclonal antibody, the way it's made is very expensive, and right now it's doing a shot every 2 weeks. I'm sure that both of the companies are racing to try to find one that's longer acting to create the molecule so it'll last longer, and I think we're going to see that. Maybe it'll be in a few years where we get our once a year shot, but if you have commercial insurance, they both have copay cards that help, and so hopefully it'll be accessible to folks.
All right, and thanks for joining us today, Dr. Puckett.
Yeah, my pleasure.